This is part one of what I call DIY, do it yourself, blood pressure management. So you're often told that you can't do it, you're too dumb, misinformed, don't have the tools, etc. I'll tell you the opposite. You can do a better job than your doctor now that we have better tools and a better understanding of high blood pressure. The first thing you're going to need is a blood pressure monitor. Now there's many excellent blood pressure monitors out there, but there's a few basic ground rules to follow. Do not get blood pressure monitors that measure blood pressure in the finger. They're convenient, they're cute, and they're inexpensive, but you don't want that because they're not accurate. Don't get a blood pressure monitor that measures blood pressure in the wrist. Those likewise are inaccurate. You want a blood pressure monitor that wraps around the upper arm. And there are many of those, many good manufacturers like Becton Dickinson and Omron. One of my favorites is what I have here. This is a Withings device. It's wireless. It's a Bluetooth device. It's self-wrapping. It's got Velcro. You just heard that. You put it on your arm, and easy as that. I take my smartphone. It's got an app on there that I downloaded, and it activates the blood pressure monitor and self-inflates. I love this device because it's so effortless. It takes only a minute. It's made by Withings, by the way, Withings. And the app tracks your blood pressure, which is very convenient. You don't have to enter any numbers. And what I like about this is you can even get your blood pressure while you're walking, doing something like on a treadmill. You know, that's a whole other conversation for another video, another report, that blood pressure during exercise is a very, very helpful value to look at. So this is because you don't have to pump it up with one of those bulbs to pump air into it. It does it itself very nicely. You can actually take your blood pressure while you're walking on a treadmill. Cardio, that's cardio with a Q, Q-A-R-D-I-O, also makes a very similar wireless Bluetooth device. Now these Bluetooth devices are a few dollars more, whereas you can get a very nice non-Bluetooth device, even self-inflating, for $59 or $69. These wireless self-inflating Bluetooth-enabled devices tend to be more like $99. Some are discounted in some retailers. But it's a little bit more expensive. I think it's worth the extra few dollars because of the ease of tracking, the ease of data entry, ease of inflation, and that added benefit. If you ever need to in future get exercise blood pressure, these things are really good. So the first step in DIY high blood pressure is to have a device that allows you to measure blood pressure. Now, the reason why you can do a better job in managing blood pressure, and we'll talk in part two about how to reduce your blood pressure, is that you're not going to use drugs. You know, the drugs are very imperfect. So the first drug advised by primary care doctors, cardiologists, etc., are diuretics, like hydrochlorothiazide. These so-called thiazide diuretics are awful. One, they cause you to be dehydrated. So wait a minute. Aren't we told that hydration is good for you, prevents kidney stones, it keeps you alert and healthy, right? And yet we're given a dehydrating agent to reduce blood pressure? So that's one problem. They have metabolic problems. They raise blood sugar, for instance. They raise triglycerides. They reduce HDL. And there's risk for sudden cardiac death. So you could take this benign drug for your blood pressure, a thiazide diuretic, and die because thiazide diuretics cause pretty substantial loss of potassium and magnesium in the urine. And low potassium, low magnesium are causes, and fairly common causes, of sudden cardiac death. It takes months to years for that to happen, but it does happen. I've seen it happen many times. There are other drugs that have adverse implications, like beta blockers. Beta blockers like metoprolol, nebivolol, carvedilol, labetalol. They all end in that OL. There's others. Raise your blood sugar, raise triglycerides, reduce HDL, and they make you gain weight or block weight loss, and they make you tired. So they're lousy. Now, there's other drugs, but they all have problems. And so the reason why you can do a better job than your doctor in blood pressure is because you're not going to use drugs. The drugs are not perfect. They introduce a whole collection of problems all of their own. That's why a person who's taking, say, 3 blood pressure drugs and obtains a normal blood pressure still has increased heart attack and stroke risk compared to a person who reduced blood pressure normal using natural means, because that person using natural means is not exposed to the excess or residual risk of drugs. You're not, for instance, being exposed to the risk for sudden cardiac death, higher blood sugar of a thiazide diuretic or a beta blocker. So you can obtain better results in blood pressure management on your own. Start with a blood pressure monitor, a good one, get comfortable with it, and then we'll talk about how to use this device in a future conversation.